brand new research published just 8 weeks ago is going to make you question everything you've been told about blood pressure medication. What if I told you that the very pills designed to protect your heart are actually making you feel terrible, and that there might be a better way to manage your blood pressure that your doctor has never mentioned? I'm Dr. Sandra Mitchell, board-certified internal medicine physician with 32 years specializing in geriatric care. After treating over 18,000 seniors, I've watched this pattern unfold thousands of times. Patients start blood pressure medication expecting to feel better, and instead they feel dramatically worse. And nobody explains why. By the end of this video, you'll understand exactly why blood pressure medications make so many seniors feel awful, what's actually happening in your body when you take these pills, and what alternatives and adjustments might help you feel like yourself again, while still protecting your cardiovascular health. But I'm not going to give you all the answers right away, because if I do, you might make a dangerous decision without understanding the full picture. First, I need you to do something for me. Comment below your age, what blood pressure medication you're taking, and how it makes you feel. Keep it simple. Format it like this: your age, the medication name, and 1 or 2 words describing how you feel. Example: 74, lisinopril, exhausted. Or 79, amlodipine, dizzy. I read every single comment, and I need to see what my audience is actually experiencing. This helps me understand the scope of what we're dealing with. Let me tell you about Robert. Robert's story is going to change how you think about blood pressure treatment forever. And I need to warn you right now. This story is one I've seen repeated hundreds of times in my practice. It's a story of good intentions leading to terrible outcomes. Robert was 76 years old when he came to see me. He was a retired firefighter from Baltimore. 40 years of service. The kind of man who ran into burning buildings when everyone else was running out. Strong, capable, independent. After retirement, he stayed active. He walked his dog 2 miles every morning. He volunteered at the fire station teaching young recruits. He bowled on a league every Wednesday night. He traveled with his wife Carol to visit their grandchildren in 3 different states. Robert was living the retirement he had earned. Active, engaged, enjoying every day. Then everything changed. Not because of a disease, not because of an accident, because of a medication that was supposed to help him. At his annual physical in January of last year, Robert's doctor noticed his blood pressure was elevated. The reading was 158/94. His doctor, a young physician fresh from residency training, was concerned. The doctor said, "Robert, this is too high. At your age, with these numbers, you're at risk for stroke and heart attack. We need to get this under control. I'm going to start you on lisinopril, 20 milligrams, and hydrochlorothiazide, 25 milligrams. Take them together every morning." Robert trusted his doctor. He had always followed medical advice. He filled the prescriptions that day and started taking his new medications the next morning. Within 3 days, Robert felt different. Not better. Worse. The first thing he noticed was the fatigue, not normal tiredness at the end of a long day. This was a bone-deep exhaustion that hit him the moment he woke up. He would open his eyes in the morning and feel like he hadn't slept at all. His legs felt heavy. His arms felt weak. The idea of walking his dog 2 miles seemed impossible. He mentioned it to Carol. "I think I'm coming down with something," he said. "I just don't have any energy." But he wasn't coming down with anything. The exhaustion continued day after day. Then came the dizziness. Robert would stand up from his chair and the room would spin. He would grab the back of the couch to steady himself. Once he nearly fell in the bathroom in the middle of the night. Carol found him gripping the sink, pale and sweating, waiting for the world to stop tilting. Then came the cough, a dry, persistent, maddening cough that started about 2 weeks after beginning the lisinopril. It wasn't a cold. Nothing came up when he coughed. It was just this tickle in his throat that wouldn't go away, this irritation that made him cough dozens of times a day. He would cough during meals. He would cough in the middle of conversations. He would wake up at night coughing. Carol started sleeping in the guest room because his coughing kept her awake. Then came the bathroom problems. The hydrochlorothiazide, a diuretic, made Robert urinate constantly. He was up 4 or 5 times every night. He couldn't go anywhere without knowing where the nearest bathroom was. A trip to the grocery store required planning around restroom locations. He stopped going to his bowling league because he couldn't make it through a game without multiple bathroom breaks. Then came the muscle cramps. Terrible cramps in his legs, especially at night. He would wake up with his calf muscles seized into hard knots of pain. He would have to get out of bed and walk around the dark house trying to work out the cramps only to have them return an hour later. Then came something even more disturbing. Robert started feeling foggy, confused. He would lose track of conversations. He would forget why he had walked into a room. He would struggle to find words that used to come easily. His wife noticed that he seemed slower, less sharp, less like himself. Within 2 months of starting blood pressure medication, Robert had transformed from an active, vibrant, independent man into someone who was exhausted, dizzy, coughing, running to the bathroom constantly, cramping and mentally foggy. He went back to his doctor. He described everything he was experiencing. He expected concern. He expected adjustments. He expected adjustments. He expected help. What he got instead was dismissal. His doctor checked his blood pressure in the office. The reading was 128/78. The doctor smiled. "Perfect," he said. "The medications are working exactly as they should. Your blood pressure is right where we want it." Robert said, "But I feel terrible. I have no energy. I'm dizzy. This cough won't stop. I'm up all night going to the bathroom." The doctor nodded sympathetically but didn't change anything. "Some side effects are common when starting new medications," he said. "Your body needs time to adjust. Give it another month or 2. The important thing is that your blood pressure is controlled. You're much safer now from stroke and heart attack." Robert went home with the same prescriptions. He gave it another month, then another. The side effects didn't improve. If anything, they got worse. The fatigue became debilitating. The dizziness led to a fall in his driveway. He scraped his hands and bruised his knee. Nothing was broken, but the fall shook his confidence. He started being afraid to walk alone. He started being afraid of his own body. 6 months after starting blood pressure medication, Robert was a different person. He had stopped walking his dog. Carol walked the dog now. He had stopped volunteering at the fire station. He didn't have the energy. He had stopped bowling. He couldn't manage it. He had stopped traveling to see his grandchildren. He was too afraid of falling, too embarrassed by the constant bathroom needs. His blood pressure was perfect. His life was destroyed. That's when his daughter, who lived out of state, came for a visit. She hadn't seen her father in 4 months. She was shocked by what she found. Her father, the firefighter who had spent 40 years saving lives, was sitting in a recliner looking 10 years older than his age. He was pale. He was weak. He didn't even get up to hug her when she walked in. He just raised his hand in a feeble wave. She pulled her mother aside. "Mom, what happened to Dad? He's like a different person." Carol started crying. "I don't know," she said. "It started after he went on those blood pressure pills. He's been going downhill ever since. His doctor says his blood pressure is perfect, but look at him." Robert's daughter was a nurse. She understood medications. She understood side effects. She understood that perfect numbers don't mean anything if the patient is miserable. She convinced her father to get a second opinion. That's how Robert ended up in my office. When I met Robert, I saw what his daughter saw. A man who was supposed to be thriving was instead surviving. Barely. He told me his story and I recognized it immediately because I had heard it 100 times before. I did a comprehensive medication review. I checked his blood pressure lying down, sitting, and standing. I did blood work to check his electrolytes. I asked detailed questions about every symptom and when it started. Here's what I found. Robert's blood pressure lying down was 132/80. Sitting, it was 120/76. But standing, after 1 minute, it dropped to 98/64. After 3 minutes of standing, it dropped even further to 92/58. His blood pressure was crashing every time he stood up. This is called orthostatic hypotension. It was causing his dizziness. It was causing his falls. It was making him afraid to move. His potassium level was 3.2. Normal is 3.5 to 5.0. The diuretic was washing potassium out of his body along with the excess fluid. Low potassium causes muscle cramps. Low potassium causes fatigue. Low potassium can affect brain function. His sodium was borderline low at 133. Low sodium can cause confusion, fatigue, and cognitive problems. The dry cough was a known side effect of lisinopril. It happens in up to 20% of patients who take ACE inhibitors. For some people, it's minor. For Robert, it was constant and debilitating, and the combination of low blood pressure, electrolyte imbalances, poor sleep from coughing and urinating, and his resulting inactivity had created a cascade of decline that had stolen his quality of life. Robert didn't have a blood pressure problem anymore. He had a medication problem. Here's what we did. We didn't stop his blood pressure medications immediately. That would have been dangerous, but we made changes. I stopped the lisinopril and switched him to losartan, which is an ARB instead of an ACE inhibitor. ARBs work similarly but don't cause that terrible cough. I reduced his diuretic dose by half. I started him on a potassium supplement to correct his deficiency. I adjusted his blood pressure target. Instead of aiming for 120/80, we aimed for 135 to 140 systolic, a target appropriate for his age and his body. I told him to drink more fluids and to add a bit more salt to his diet to help maintain his blood volume. And I told him something that changed his entire perspective. "Robert," I said, "your previous blood pressure of 158/94 was worth treating. But the goal of treatment isn't to achieve a perfect number. The goal is to reduce your risk of stroke and heart attack while maintaining your quality of life. If the treatment destroys your quality of life, the treatment has failed, no matter what the numbers say." Within 2 weeks, the cough was gone. Gone completely. Robert could sleep through the night without coughing himself awake. He could have conversations without interruption. Carol moved back into their bedroom. Within a month, his energy was returning. His potassium normalized. The muscle cramps stopped. He started walking his dog again, short distances at first, then longer. Within 6 weeks, his dizziness had improved dramatically. His standing blood pressure was now 118/72, a much safer drop than before. He felt steady on his feet. He wasn't afraid of falling. Within 3 months, Robert was back. Not perfect because 6 months of decline had taken some toll. But himself. Bowling again. Volunteering again. Planning a trip to see his grandchildren. His blood pressure, around 138/82 on average, higher than his previous perfect reading. But Robert felt like a human being instead of a patient waiting to fall apart. When I hear about Robert's case now, when I think about those 6 months he lost, I feel frustrated. Because this was completely preventable. Because his experience is not unusual. Because millions of seniors are right now experiencing exactly what Robert experienced, feeling terrible on blood pressure medications, being told their numbers are perfect, and having their suffering dismissed. Comment, same experience. If Robert's story sounds like your story, comment, someone I know, if you've watched a spouse, parent, or friend go through something similar. I need to know how many people are living this right now. So what's actually happening when blood pressure medication makes you feel terrible? Why do so many seniors start these pills and immediately feel worse? And why don't doctors recognize this pattern more often? For decades, the medical establishment has pushed one message: lower blood pressure is better. Get those numbers down. The lower you go, the safer you are. Every point of blood pressure reduction saves lives. And there's truth in this. High blood pressure does increase the risk of stroke, heart attack, kidney disease, and other serious problems. Treating high blood pressure does save lives. The medications work. But here's what nobody explains clearly. Those benefits were established primarily through studies on younger and middle-aged populations. The body of a 78-year-old works very differently than the body of a 52-year-old. And what helps a younger person can harm an older one. Let me explain what's happening in your aging body that makes blood pressure medication so problematic. First, your blood vessels change as you age. Your arteries become stiffer, less elastic. They don't expand and contract the way they used to. This means your body has less ability to compensate when blood pressure drops. When you're young and you stand up quickly, your blood vessels can tighten to push blood to your brain. When you're 75, that response is slower and weaker. A medication that drops your pressure too much leaves your brain without adequate blood flow. That's why you get dizzy. That's why you fall. Second, your kidneys change as you age. Your kidneys are responsible for clearing medications from your body. But kidney function declines with age, even in healthy people. A medication dose designed for a 60-year-old can be too strong for an 80-year-old because the older kidney can't clear the drug as efficiently. The medication builds up. The effects become excessive. Third, your baroreceptors become less sensitive. Baroreceptors are sensors in your blood vessels that detect pressure changes and signal your body to compensate. As you age, these sensors work less well. Your body is slower to recognize that your blood pressure has dropped, slower to respond, slower to correct the problem. This contributes to orthostatic hypotension and that terrible dizziness. Fourth, your brain becomes more vulnerable to reduced blood flow. The aging brain depends on consistent, adequate blood supply. When blood pressure drops too low, the brain doesn't get enough oxygen. This causes fatigue, confusion, memory problems, and that foggy feeling so many seniors on blood pressure medication describe. You're not imagining it. Your brain is actually not getting what it needs. Fifth, you're likely taking multiple medications. Polypharmacy, the use of multiple medications simultaneously, is extremely common in seniors. The average person over 75 takes 5 or more prescription drugs. These medications interact with each other in ways that are difficult to predict. A blood pressure medication that might be fine by itself can cause problems when combined with other drugs you're taking. The more medications you take, the higher your risk of adverse effects. There are 5 specific side effects that are particularly common when seniors take blood pressure medications. You need to know about all of them. Side effect number 1 is fatigue and weakness. This is perhaps the most common complaint I hear. Patients describe feeling like they've been drained of energy. They wake up tired, they stay tired all day. Simple activities that used to be easy become exhausting. This happens because blood pressure medication reduces the force with which your heart pumps blood and the volume of blood reaching your muscles and brain. Your body is literally getting less of what it needs to generate energy. Beta blockers are particularly notorious for causing fatigue. Medications like metoprolol, atenolol, and carvedilol slow your heart rate and reduce the heart's pumping strength. For some patients, this creates a constant feeling of sluggishness. Diuretics can also cause fatigue by depleting fluid volume and electrolytes. Side effect number 2 is dizziness and lightheadedness, especially when standing. This is orthostatic hypotension, and it's dangerous. When you stand up, blood naturally pools in your legs due to gravity. Normally, your body compensates by tightening blood vessels and increasing heart rate to push blood back to your brain, but blood pressure medication interferes with these compensatory mechanisms. The result is that standing up causes a dramatic drop in brain blood flow. The room spins. You feel faint. You might fall. Falls in seniors are not minor events. They cause hip fractures, head injuries, hospitalizations, and loss of independence. A medication that increases fall risk can be more dangerous than the condition it's treating. Side effect number 3 is frequent urination and electrolyte imbalances. Diuretics, sometimes called water pills, work by making you urinate more to reduce fluid volume and lower blood pressure. But they don't just remove water. They also remove essential electrolytes like potassium, sodium, and magnesium. Low potassium causes muscle cramps, weakness, and abnormal heart rhythms. Low sodium causes confusion, fatigue, nausea, and in severe cases, seizures. And the constant need to urinate disrupts sleep, limits activities, and affects quality of life. Side effect number 4 is cough and respiratory symptoms. ACE inhibitors, a very common class of blood pressure medication including lisinopril, enalapril, and ramipril, cause a persistent dry cough in up to 20% of patients. The cough is caused by a buildup of a substance called bradykinin in the lungs. It's harmless in the sense that it doesn't indicate lung disease, but it can be incredibly annoying. Some patients cough constantly, day and night. The cough can disrupt sleep, interfere with conversation, and significantly reduce quality of life. Many patients don't connect the cough to their medication because it can start weeks after beginning the drug. Side effect number 5 is cognitive effects and mood changes. This is perhaps the most under-recognized problem. Blood pressure medications can affect brain function. Some patients experience memory problems, difficulty concentrating, confusion, or mental fog. Some experience depression, anxiety, or mood changes. Beta blockers are particularly associated with depression and fatigue, and any medication that reduces blood flow to the brain can potentially affect cognitive function. The tragedy is that many seniors experiencing these cognitive effects are told they're just getting old. Or worse, they're diagnosed with dementia when the real problem is their medication. Now, before we go further, I need to hear from you. Comment fatigue if exhaustion is your main complaint since starting blood pressure medication. Comment dizzy if dizziness and lightheadedness are your biggest problem. Comment bathroom if constant urination is disrupting your life. Comment cough if you've developed a persistent cough. Comment foggy if you're experiencing mental fog or memory problems. Tell me what you're dealing with. I read every comment, and this information helps me help you. Now you're wondering what you should do about all this. You want to know if you should stop your blood pressure medication. You want solutions. I'm going to give you solutions. But first we need to understand something important. The fact that blood pressure medications often make seniors feel terrible doesn't mean blood pressure doesn't matter. It does. Uncontrolled high blood pressure genuinely increases your risk of stroke, heart attack, kidney disease, and other serious problems. The goal isn't to avoid treatment entirely. The goal is to find an approach that protects your cardiovascular health without destroying your quality of life. This is where modern medicine often fails seniors. Doctors are trained to hit target numbers. They're measured on whether patients achieve certain blood pressure goals. They're following guidelines that were developed primarily from studies on younger populations. The individual patient sitting in front of them, the 78-year-old who feels terrible but has perfect numbers, often gets lost in the focus on targets. Let me walk you through the comprehensive approach I use with my patients. This isn't about stopping medication. It's about optimizing your entire treatment plan. The first step is getting an accurate picture of your blood pressure. This means home monitoring, not just office readings. Blood pressure in a doctor's office is often artificially elevated due to what's called white coat syndrome. The stress of being in a medical setting raises blood pressure temporarily. Doctors then prescribe medication based on these inflated numbers. The patient takes medication for blood pressure that isn't actually that high in real life. The medication then drops their real blood pressure too low, causing side effects. Home monitoring solves this problem. You get a picture of what your blood pressure actually is when you're relaxed and living your normal life. Here's exactly what to do. Buy an automatic upper arm blood pressure cuff. Omron and similar brands are widely available and reliable. Spend $30 to $50 on a validated monitor. For 2 weeks, check your blood pressure twice daily, once in the morning, after you've been awake for an hour but before taking medications, once in the evening, at least 2 hours after dinner, and any caffeine. Each time you check, sit quietly for 5 minutes first. No television, no conversation, no checking your phone. Feet flat on the floor, arms supported at heart level. Take 2 readings, 1 minute apart. Write down all 4 numbers from both readings along with the date and time. After 2 weeks, calculate your average. This is your real blood pressure. This is the number that should guide your treatment, not the single reading taken when you are nervous in a doctor's office. The second step is checking your standing blood pressure. This is critical and almost never done in routine medical care. After sitting quietly for 5 minutes, take your blood pressure sitting down. Write down the numbers. Then, stand up. Wait 1 minute. Take your blood pressure standing. Wait 2 more minutes. Take it again. What you're looking for is a drop in systolic pressure of more than 20 points, or a drop in diastolic pressure of more than 10 points when you go from sitting to standing. If this happens, you have orthostatic hypotension. Your medication is likely too strong and you're at high risk for falls. Bring this information to your doctor. Most doctors don't check standing blood pressure routinely. When you show up with data demonstrating orthostatic hypotension, it changes the conversation. The third step is a comprehensive medication review. You need to understand every medication you're taking and whether it might be contributing to your symptoms. Make a list of all your medications, including over-the-counter drugs and supplements. For each one, write down the name, dose, and when you take it. Research each medication's potential side effects, the pharmacy printout that comes with your prescription lists these. So do reputable websites like drugs.com and Medline Plus. Look for patterns. Did your symptoms start or worsen when a particular medication was added or when a dose was increased? Is there overlap in side effects between multiple medications you're taking? Bring this research to your doctor. Many doctors are too rushed to do this kind of detailed review themselves. When you come prepared, you enable a more productive conversation. The fourth step is understanding what blood pressure target is actually appropriate for you. Current guidelines suggest different targets for different populations. For most adults, a target of below 130/80 is recommended. But for adults over 65, and especially for those over 75, many experts argue that more relaxed targets are appropriate. The evidence shows that for seniors over 75 without cardiovascular disease, aggressive blood pressure targets provide minimal additional benefit, while significantly increasing the risk of side effects. A systolic blood pressure of 140 or even 150 may be perfectly acceptable for an older adult, especially if lower targets are causing problems. Ask your doctor specifically what target you're aiming for and why. Ask whether a more relaxed target might be appropriate, given your age and how you're feeling. If your doctor insists on aggressive targets despite significant side effects, consider getting a second opinion from a geriatric medicine specialist. The fifth step is exploring alternatives to your current medication. Not all blood pressure medications are equal. Different classes work differently and have different side effect profiles. If one medication is causing problems, another might work just as well without those particular side effects. Let me walk you through the major classes. ACE inhibitors include lisinopril, enalapril, and ramipril. They're effective but commonly cause dry cough. If cough is your main problem, switching to an ARB, which works similarly without the cough, often solves the issue. ARBs include losartan, valsartan, and irbesartan. They're similar to ACE inhibitors but don't cause cough. They're often better tolerated and are a good alternative if ACE inhibitors are causing problems. Calcium channel blockers include amlodipine, diltiazem, and verapamil. They can cause ankle swelling, constipation, and dizziness. Some types slow the heart rate. They're effective but not ideal for everyone. Diuretics include hydrochlorothiazide, chlorthalidone, and furosemide. They cause frequent urination and electrolyte imbalances. They're often used in combination with other medications. Reducing the dose or switching to a different class can help if urinary frequency is disrupting your life. Beta blockers include metoprolol, atenolol, and carvedilol. They're particularly associated with fatigue, depression, and cold hands and feet. They slow the heart rate. For many seniors without specific indications like heart failure, beta blockers may not be the best choice for blood pressure alone. If you're having side effects, ask your doctor whether a different medication class might work better for you. Many patients tolerate one class well while having significant problems with another. The sixth step is implementing lifestyle modifications that genuinely work. Before we had blood pressure medications, lifestyle was the only option. And for many people, lifestyle modifications can be remarkably effective. Some patients can control their blood pressure entirely through lifestyle changes. Others can at least reduce the dose of medication they need. Here are the evidence-based approaches. Reduce sodium intake. This doesn't mean eating a bland diet. It means being aware of hidden salt in processed foods and making smart choices. Aim for less than 2,300 milligrams of sodium daily. Some people are salt sensitive and see dramatic improvements with sodium restriction. Increase potassium intake. Potassium helps counteract the effects of sodium. Foods rich in potassium include bananas, potatoes, beans, yogurt, and leafy greens. If you're on certain blood pressure medications, check with your doctor before dramatically increasing potassium. Maintain a healthy weight. Even modest weight loss can lower blood pressure. Losing 10 pounds can make a measurable difference. Exercise regularly. Aerobic exercise like walking, swimming, or cycling has been shown to lower blood pressure by 5 to 10 points on average. 30 minutes most days of the week is the target. Even shorter sessions help. Limit alcohol. More than moderate alcohol consumption raises blood pressure. If you drink, limit to 1 drink daily for women and 2 for men. Manage stress. Chronic stress raises blood pressure. Relaxation techniques, meditation, deep breathing, and activities you enjoy all help. The seventh step is working with your doctor to implement changes safely. Never stop or change blood pressure medication on your own without medical supervision. Stopping abruptly can cause dangerous rebound increases in blood pressure. Changes need to be made gradually with monitoring. But you absolutely have the right to advocate for changes if your current treatment is making you miserable. Here's how to approach the conversation. Start with this opening. Say, "Doctor, I've been tracking my blood pressure at home and experiencing significant side effects from my current medication. I'd like to discuss whether we can adjust my treatment plan to improve my quality of life while still protecting my cardiovascular health." Present your data. Share your home blood pressure log. Share your standing blood pressure readings. Describe your specific symptoms when they started and how they affect your daily life. Ask these questions. Is my current blood pressure target appropriate for someone my age? Could we try a lower dose or a different medication class? Are there lifestyle modifications that might allow me to reduce my medication? What would happen if we aimed for a slightly higher blood pressure to reduce side effects? If your doctor dismisses your concerns without engaging with your data, consider seeking a second opinion. A geriatric medicine specialist or a physician who specializes in treating older adults may be more attuned to these issues. Now let me address the most common questions I hear about this topic. The first question is, but isn't high blood pressure dangerous? Shouldn't I just tolerate the side effects to protect my heart? Here's the balanced answer. Yes, uncontrolled high blood pressure is genuinely dangerous. It increases your risk of stroke, heart attack, and other serious problems. Treatment is appropriate for most people with sustained high blood pressure. But here's what doctors often fail to consider. Side effects are also dangerous. Falls cause hip fractures, head injuries, and death. Fatigue leads to inactivity, muscle loss, and functional decline. Cognitive effects reduce quality of life and can be mistaken for dementia. At some point, the harm from side effects can outweigh the benefit from treatment. The goal is to find the balance that provides cardiovascular protection without destroying quality of life. This usually means individualized treatment, not one-size-fits-all targets. The second question is, my doctor says my blood pressure is perfect, but I feel terrible. Who's right? You're both right, in a sense. Your blood pressure number may indeed be at target, but your quality of life matters too. A treatment that achieves perfect numbers while making you miserable is not successful treatment. It's incomplete treatment. Numbers on a chart don't experience side effects. You do. A good doctor will treat you as a whole person, balancing numerical goals with functional outcomes. If your doctor only cares about the numbers and dismisses your suffering, find a different doctor. The third question is, should I stop my blood pressure medication? Absolutely not without medical supervision. Stopping blood pressure medication abruptly can cause dangerous rebound increases in blood pressure, potentially leading to stroke or heart attack. If you want to reduce or stop your medication, this needs to be done gradually, with monitoring, under your doctor's guidance. But advocating for changes is appropriate. Asking questions is appropriate. Getting a second opinion is appropriate. Being an active participant in your care is your right. The fourth question is, are there natural alternatives to blood pressure medication? There are lifestyle modifications that can genuinely lower blood pressure, and I've discussed them in detail. For some people with mild hypertension, these measures can be sufficient. For others, they can reduce the dose of medication needed. But be skeptical of supplement claims. Many products marketed as natural blood pressure remedies have little or no evidence supporting them. Some can even be harmful or interact with medications. Stick with evidence-based lifestyle approaches and work with your doctor on any changes. The fifth question is, I'm caring for an elderly parent who seems to be suffering from blood pressure medication side effects. How can I help? As a family caregiver, you may be in the best position to notice changes and advocate for your loved one. Many seniors don't complain about side effects because they assume feeling bad is just part of getting old. Observe carefully. Has your parent become more fatigued, more confused, more unsteady since starting or changing medications? Document what you're seeing. Bring your observations to medical appointments. Be willing to ask hard questions. And remember that you can request a second opinion or a referral to a geriatric specialist if you feel concerns are being dismissed. Before we continue, I want to hear from you. Comment "need changes" if you're going to talk to your doctor about adjusting your blood pressure treatment. Comment "trying lifestyle" if you're going to implement lifestyle modifications to improve your blood pressure. Comment "advocating" if you're going to advocate for an elderly parent or spouse. Let me know where you stand. Now let me tell you about Dorothy. Dorothy's story shows what's possible when blood pressure treatment is done right. Dorothy was 81 years old when she came to see me. She had been on 3 blood pressure medications for 5 years: lisinopril, amlodipine, and metoprolol. Her blood pressure was controlled at 118/70. Perfect numbers by any standard. But Dorothy was struggling. She was exhausted all the time. She had that persistent ACE inhibitor cough that interrupted her sleep and embarrassed her in public. She was dizzy when she stood up. She had swollen ankles from the amlodipine. She felt depressed and had lost interest in activities she used to enjoy. She attributed all of this to being 81 years old. "I guess this is just what getting old feels like," she told her previous doctor. Her previous doctor agreed. He told her that her blood pressure was perfect and that her symptoms were just normal aging. He didn't change anything, but Dorothy's daughter thought something was wrong. She remembered her mother at 75, still active and energetic. The decline over the past 5 years seemed too dramatic to be just aging. When Dorothy mentioned that most of her symptoms had started or worsened after blood pressure medications were adjusted 5 years ago, her daughter did research and found information similar to what I shared with you today. Dorothy's daughter brought her to my practice for a second opinion. Here's what I found. Dorothy's sitting blood pressure was 118/70. Her standing blood pressure dropped to 94/56, severe orthostatic hypotension. No wonder she was dizzy. Her heart rate was 52 beats per minute. The metoprolol was slowing her heart too much. This contributed to her fatigue and possibly her depression. She was on maximum doses of 3 medications. Nobody had ever tried to reduce them. Here's what we did. We stopped the lisinopril and switched to a low dose of losartan. The cough disappeared within 2 weeks. We gradually reduced the metoprolol. Her heart rate came up to a healthier 68 beats per minute. Her energy improved. Her mood lifted. We reduced the amlodipine dose. Her ankle swelling decreased. We set a new blood pressure target, 135 to 145 systolic. Higher than before, but appropriate for her age. 3 months later, Dorothy's blood pressure averaged 138/78, higher than the perfect 118/70 she had before. But her standing blood pressure no longer dropped dangerously. She was down from 3 medications to 2 at lower doses. More importantly, Dorothy felt like herself again. The fatigue lifted. The cough was gone. The dizziness resolved. The depression improved dramatically once she stopped the beta blocker. 6 months after we made changes, Dorothy called my office. She was planning a trip to Europe with her daughter, something she hadn't felt capable of in years. "I thought I was dying," she told me. "I thought I was just old and worn out. I had no idea it was the pills. I can't believe how much time I lost." Dorothy is now 83. She's traveled internationally twice since we adjusted her medications. She walks daily. She plays cards with friends. She enjoys her grandchildren. Her blood pressure runs a little higher than guidelines suggest. But Dorothy is living her life instead of just existing. That's what successful treatment looks like. Not perfect numbers on a chart, a person who feels well and can enjoy their life. I think about Robert often. I think about those 6 months he lost, sitting in a recliner, watching his life shrink, feeling terrible while his doctors told him his numbers were perfect. If Robert's first doctor had understood what I've explained today, if someone had checked his standing blood pressure, if anyone had recognized that perfect numbers don't mean anything if the patient can't function, he might not have lost those months. He might not have fallen in his driveway. He might not have stopped everything that made his life worth living. That's why I made this video. That's why I'll keep speaking out until every senior and every doctor treating seniors understands that blood pressure treatment is not just about numbers. It's about people, whole people, with lives and activities and loved ones and goals. You now have knowledge that many patients never receive and that too many doctors overlook. You understand that blood pressure medications commonly cause significant side effects in seniors, including fatigue, dizziness, frequent urination, cough, and cognitive effects. You know that what feels like normal aging might actually be medication side effects that are completely reversible. You've learned how to monitor your own blood pressure accurately, how to check for orthostatic hypotension, and how to review your medications for problems. You understand that blood pressure targets should be individualized based on age, and that aggressive targets may cause more harm than good in older adults. You have a framework for talking to your doctor and advocating for treatment that protects your heart without destroying your quality of life. This is power. This is information that can give you your life back. But information is only power if you act on it. Here's what I want you to do this week. First, get a home blood pressure monitor if you don't already have one. Start tracking your pressure twice daily. After 2 weeks, you'll have data that can change your entire treatment approach. Second, check your standing blood pressure at least once using the protocol I described. This simple test could reveal whether your medication is putting you at risk for falls. Third, make a list of all your medications and research their side effects. Look for connections between your symptoms and your drugs. Fourth, schedule an appointment with your doctor. Bring your data. Use the conversation approach I described. Ask whether your treatment can be optimized. Fifth, if your doctor dismisses your concerns without engaging with your information, get a second opinion. Consider seeing a geriatric medicine specialist who understands the unique needs of older adults. You deserve to feel well. You deserve treatment that helps rather than harms. You deserve a doctor who listens. Before you go, I need you to do 3 things. First, subscribe to this channel. Click the subscribe button right now and turn on notifications. My mission is to help seniors live healthier, more independent, more enjoyable lives by giving you information that improves your care. Every week, I share evidence-based content on the issues that matter most to adults over 60. Medications, side effects, aging well, advocating for yourself. If this video helped you, there's more coming. Subscribe so you don't miss it. Second, share this video. Right now, while it's fresh in your mind, think of someone who needs to hear this. Your spouse who's been exhausted since starting blood pressure pills. Your sibling who's dizzy all the time. Your friend who can't stop coughing. Your neighbor who seems to have aged years and months since changing medications. Copy the link. Send it to them. Post it on Facebook. Text it to your family group chat. This information could change someone's life. Don't keep it to yourself. Third, leave a comment. I read every single comment, and I want to hear from you. Comment one of 3 things. Getting my life back? If this video showed you that your symptoms might be reversible. Making changes if you're going to talk to your doctor or adjust your approach. Sharing now if you're sending this video to someone who needs to see it. Let me know where you are in this journey. Thank you for watching until the end. Thank you for caring about your health enough to spend this time learning how to feel better. Thank you for being willing to advocate for yourself. Remember this. You are not just a blood pressure reading. You are not just numbers on a chart. You are a person with a life to live. And any treatment that makes that life miserable is not successful treatment, no matter what the numbers say. You deserve to feel well. You deserve to be heard. You deserve care that treats you as a whole person. I'll see you in the next video. Stay informed, stay empowered, stay well. This video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen in this video. The cases described in this video are illustrative examples, and some details have been changed to protect privacy. Never change your medication dosage, stop taking prescribed medications, or alter your treatment plan without first consulting your doctor. Blood pressure management must be individualized with your physician's guidance based on your specific health situation.